According to statistics, alcohol is by far the most commonly used drug in sexual assaults, but the use of so-called knockout drugs are on the rise here in the U.S. A powerful sedative, commonly called roofies, is one of the most infamous date rape drugs. Many psychologists are now asking why some men choose to utilize these drugs when they seemingly have easy access to willing sex partners. Andrew Lester is an often discussed case in point. The heir to a cosmetic fortune was convicted in 2003 of raping 3 women after giving them date rape drugs. Dr. James Cantor is an associate professor of psychiatry at the University of Toronto who specializes in sexology, and he's joining us from Canada to talk about this issue. Thank you so much for being on our show, Dr. Cantor. I appreciate it. First of all, just give me a general idea of how common it is that an attacker will use a drug other than alcohol to assault their victim.
Well, it's difficult to get precise statistics exactly because rape is so vastly underreported in society. Even more unknown are the different motivations that people have. Although using a drug, whether it's alcohol, GHB, or some other drug to incapacitate a victim is well known, cases like the Andrew Lester case are even more rare and probably even more dangerous. These are people who don't use the drug to incapacitate a victim. They use the drug because they actually prefer their sex partners to be unconscious or non-responsive.
Dr. Cantor, talk a little bit more about that. What is that phenomenon?
There's a word for the phenomenon. We usually call it filia. It's a very atypical sexual interest. It's one of what we call the paraphilias, which is a whole group of very unusual sexual interests. Now, not to confuse the term, but the paraphilias are almost like a sexual orientation. Now, I want to draw a very thick black line between a sexual orientation like a paraphilia and plain vanilla healthy homosexuality. I just use the word to indicate that this is something that's very, very integrated into the personality and something that doesn't seem to be able to change with any kind of therapy.
Well, and that's what I was going to ask you. Do I take that to mean that there is no treatment or this can't in some way be cured or managed?
There doesn't seem to be a way to turn a paraphilic person into a non-paraphilic person. We can treat those kinds of cases, usually, and by treat, I mean when somebody comes into my office with, "Doc, I got a problem," really the best we can do is to help the person integrate their sexual interest into their life in some healthy way. We can't get rid of the sexual interest, but we can help the person live in a healthy way with that interest.
Is there a particular profile, having this diagnosis in mind, but a profile of a person that tends toward this behavior to exhibit this somnophilia?
Let me unpack that question a little bit. There's no personality cluster that will tell us who might have the sexual interest and who doesn't. But there do seem to be some kind of clues about who will actually act on that interest in order to hurt another person. That is, a person who recognizes that they have the sexual interest and that it certainly has the potential to hurt someone. Most of those people will keep it inside. They will use it as a sexual fantasy. They'll find sex partners who will kind of indulge them on it a little bit. But the people who are more dangerous, the people who are antisocial or psychopathic and will actually inflict the drug on an unwilling partner, those are the more dangerous ones. And those tend to be people who are more antisocial, more criminological, and they tend, in general, to be less willing to entertain the needs and well-being of other people.
Is there much of a body of scientific work studying these people?
Very, very little. It's unfortunate, and especially in the U.S., there's really very little interest in supporting any kind of sex research. And of course, funding sex research for atypical sexualities is even harder.
Let's talk about, I think you've addressed this, the 3 primary motives used by men to get sex, and paraphilia is one of those. Talk about those other 2.
One is indeed, as you say, the paraphilias. Those are people with the sexual interest in a non-responsive partner. The other group of people are the ones who do use the date rape drugs. Those are people who, even though they would prefer a regular, everyday, willing, consenting, and engaged partner, they'll use the drugs anyway in order to gain access to a partner that they think they wouldn't otherwise be able to get them willing. Those are the ones who use drugs really to incapacitate their victims to gain access rather than to turn their partner into somebody who resembles what they want. And then the other type are people who use alcohol or drugs in a relatively light and can range anywhere from relatively healthy uses of alcohol, social as a relative social lubricant, to the ones who kind of overdo it in order to overwhelm the partner, to kind of make them do things that they otherwise, when they were sober, wouldn't be willing to do.
Is it fair to say that those that exhibit this paraphilia, or more specifically the somnophilia, are nonviolent?
Depends on what you mean by nonviolent.
And I heard you say that in my head as it came out of my mind, because the act of attacking someone is indeed violence, but in terms of physical battery or assault, harm to the body, beyond the sexual attack.
They rarely use other kinds of weapons. These are usually very different kinds of people. There is another paraphilia, which is dangerous in its own right, of course, sexual sadism. Those are the people who actually have a sexual preference for the terror in the response of the person. So that's the much more familiar type of sexual offense, where it's, obvious violence, as opposed to the drug use, which is an indirect violence or less visible violence.
Is this disorder, the paraphilia, is it unique to gender? Is it mainly men that exhibit these behaviors?
Almost always. Really, the paraphilias seem to be related to something in the brain that's related to the sexual differentiation of the brain, and it's exhibited almost always by men. The only exception are people who are sexual masochists, which has a relatively high, somewhere between 10 and 20% in women.
Dr. James Cantor, such a fascinating and, may I just say, icky topic. But Dr. Cantor, you really illuminated it. Thank you very much. I appreciate it.
My pleasure.